Good morning. My name is Abe Chavez0. This is going to be the workforce education for Penn State 106. I will be doing my presentation on orthostatic intolerance. So the title of this lesson that we're going to be talking about here is, okay, so the harness saved me. What do you mean I'm going to die? Well, we've already gone over what it is to how tight we're supposed to keep our harnesses. A couple fingers in between. That's how you know that you don't have it too tight. But now I'm going to be going over what happens after you've fallen and now you're suspended. Okay. A couple of things with orthostatic intolerance, a definition of it. It goes by orthostatic intolerance. It can also go by orthostatic incompetence. What it is basically a reduction in the blood flow back to the heart. Okay, so now you don't have enough blood coming back here to keep you going. An example of this would be a soldier who stands at attention for a long time. The legs are locked. After a while, he gets dizzy, passes out. Now, when he passes out, he goes ahead and he lands in a horizontal plane. Now, because his legs were locked, that blood was pooled down there. When he passes out, legs loosen up, blood starts flowing back to the heart. He usually comes out of it no problem. Now, our problem is going to be because when we fall, our legs are immobile. We're stuck. You're hanging here. When this thing goes off, you're hanging like this. It's not this, and you're not laying flat. You're hanging at an angle and your legs are dangling in front of you. Also, when these parts of the harness get snug and tight, it acts like a tourniquet. Okay, so it will cut off the circulation. Now, if you become unconscious, then absolutely it's going to be tough for you to move your legs. And you have to be able to move your legs to get the blood back to your heart. Talking about a little bit of the anatomy that goes along with this, okay? We have arteries and veins. Arteries are under pressure. An example of that would be if you were to get cut on an artery in your arm, they can have an arterial spray up to 30 feet, okay? Because it's under pressure from the heart. Now, if you have venous cutting, which is cutting in the veins, it's going to pool out of you because it takes muscle contractions to go and push that blood back up to your heart. Okay, so you have the pressure underneath with the arteries, and then you have where it's pooling and needs to be pushed back with the veins. Now, our bodies have about 10 pints of blood on average, and on average we usually have about 2 pints going in and out of our legs. In a suspension trauma situation, you can have anywhere from 4 to 6 pints of blood stuck in your legs once these become tourniquets. Once you're hanging and they are pushing up, they are blocking off the arteries that run down your legs, the femoral arteries. Okay? At 4 pints of blood, you're in serious shock. You are in serious trouble. You can die. With that much blood out of your system, no one can survive. Prompt rescue is going to be the key for your survival. There needs to be a rescue plan in place before anybody gets out there in a harness. They also need to practice how they're going to rescue you. Not just, well, here's the paper, sign it, and then when you fall, well, we got to follow the paper. You don't have time to go and find a paper. Usually it takes 3 to 5 minutes after you fall and go, oh geez, looks like somebody fell. You don't have that time, okay? In 12 to 15 minutes, you can have some real trouble. If you pass out, there is a strong chance you are going to die. While suspended, the victim loses the ability to transport the blood back to the heart. So in other words, as you're hanging there, your muscles get tired, it's going to be uncomfortable, it's going to be real hard for you to pump your legs. That would be the one way that you can go ahead and get that blood back to your heart. Consider it like pumping an invisible bicycle. That would be one way to get that blood back. Okay? But now you're fighting that tourniquet. Now clots can form. Lack of blood in the system is going to tax your heart. It's going to make it real hard for your heart to work. It's used to working with those full 10 pints. Increased blood pressure to the brain, it will be caused because you have lost that blood in your legs. So now you've got only this much blood. That heart is going to beat the band to go ahead and keep that area that's still got a ways to work. It's going to try and really keep that system going. Now if you're rescued and you're laid down flat and they release the harnesses, there is a severe chance that you can die. There was an Austrian study back in 1972 where they went and they studied the victims, and they ranged from anywhere from 15 minutes to 8 hours to 30 hours stuck in a harness. And what they found is that when they pulled the harnesses off, some of them had heart attacks and died right away. But with the people that were alert and knew, hey, I've been rescued, they pulled the harnesses off, laid them down, all that bad blood came rushing back to the heart, caused heart attacks, and they died. They died. Now the reason we talk about climbers and stuff like that with the Austrian study is because they're the other ones that use harnesses on a regular basis, not just us. Okay? The other thing that can happen is you can feel fine for a couple of days. And then all of a sudden, now you've got real trouble. Because your heart and your kidneys can be damaged because of the clots and because of the lack of oxygen. You need to let paramedics know when you're rescued that you have had a suspension trauma accident. They have specific ways of taking care of you and taking you to the hospital. If you pass out, there's a strong chance that it's going to be game over. No ifs, no ands, no buts. With types of rescue, we have two. We have self-rescue and then being rescued. Self-rescue is considered the best because if you can self-rescue, then you don't have to worry about the trauma. You're already climbing yourself back up. You're rescuing yourself. Now they do sell these straps. I don't have them, but they do. They come down off of your harness, and you can stick your feet in them, and you can pump your legs, and that helps. With someone who's being rescued, you need to supervise them at all times. You need to make sure that you're watching to see that they are not having any signs or symptoms of orthostatic intolerance. Time is going to be of the key on this. If possible, lower a rope or an extension cord. And with that, if you are fortunate enough to have a rope that's already got an eye splice in it, you can go ahead, lower it down, have them put it in on the foot. And with this, they can go ahead and they can push up on it, and that can help take that pressure off of that harness. Okay, so now the blood can go back, and they can pump their leg, and they can go ahead and take care of that blood coming back. The other thing that can be done, and this I just brought out an old extension cord, but it can also be done with a rope or what have you. Say that they're hanging there. You throw this down, they form a loop, put the foot in the loop, okay? Then stick the other foot down. With this, they can pump their legs up and down. That will also take the pressure off the harness so that they can get the blood back and forth to their heart. That will help. So you have some options. You're not just stuck going, I don't know. Okay? Now we'll go ahead and talk about some of the signs and symptoms of orthostatic intolerance. If your victim is getting faint, lightheaded, dizzy, sweating, pale, nauseous, or having hot flashes, these are all signs that they're starting to have orthostatic intolerance. Some of the symptoms would be an increased heart rate because they don't have as much blood as they used to, and their heart is really pumping hard to get that blood going. Unusually low heart rate because they don't have the volume of blood. Also, a lowered blood pressure. There again, all that blood that they had is now stuck in the legs, and so now they're having trouble getting it back up to that heart. Also, a graying or loss of vision. Things are starting to fade out. Okay? Once again, if they pass out, your chances are really big that you're going to die. Okay? Now, once the victim has been rescued, it is so important to be very wary of how we handle them. Do not have them lay down horizontally. Don't have them lay down. Okay? Do not take off the harness. Leave them in that harness. That harness, they were walking around in before the fall, and it was comfortable. Don't go pulling that thing off. You're going to send all that blood that, if it's been deoxygenated for 12 to 15 minutes, it's going to have clots. It's going to be bad for that heart. It will send them into a heart attack. It will kill them. If they have first aid injuries, we're going to take care of that first, naturally. If they got bleeding, we're going to take care of that. We're going to monitor them for signs and symptoms of orthostatic intolerance. Want to make sure that we are keeping aware of what's happening with them. Now, it can take up to 30 to 40 minutes to move them your victim from a kneeling to a sitting to a laying position. Generally, the paramedics in our world are there within 20 minutes of phone call. So we want to make sure that we have got them on the way. With that, so with the kneeling, have them kneel. This lets the blood come back slowly. Then we have them sit, and then finally, if we had to, have them lay down. If you have something to drink it fast. It will increase the blood volume in your system, which will help out. Staying seated allows pooled blood to come back to your heart slowly, so that's one of the things that we want to keep in mind. Also, get them to the hospital. Once again, reminding the paramedics, doctors, that you have been in a suspended trauma situation so that they can handle your case on an individual basis. All right, so we've gone over orthostatic intolerance, what it is, anatomically, with the blood pooling in the legs, why we need to be prepared beforehand, what it's going to take to be ready in case of a fall. We've also talked about some of the signs and symptoms and how we're going to take care of our victims once we have rescued them. Does anybody have any questions? Okay, when we get out into the shop, we're going to go ahead and practice our putting on and off our harnesses, and then I'll be asking you guys some questions on orthostatic intolerance. All right, thank you.